All right. So recording the presentation portion of this so we can have it as a resource, sharing it out. But yeah, what it's saying, we're here to support the local health food safety programs. Over the last couple of years, it seems the unlicensed, mainly temporary food service type establishments have really ramped up more and more over the years, and local health has been very busy and oftentimes overwhelmed by the numbers. And as we meet with local health jurisdictions, we hear themes throughout, and some of the things that we're hearing are things that we at DOH, Department of Health, or at local health jurisdictions don't have the um, authority to address. Um, Many locals have gotten creative and made some partnerships with other jurisdictions, other local jurisdictions, local health jurisdictions, and municipalities, towns. Um, uh, but a lot of work has gone into this, and it's still a fairly large issue that that perhaps needs more resource and more um, as we go through these presentations. I'm hoping that folks will hear different things that may be uh, within your role. Or we have here state agencies, many state agencies, Department of Revenue, Department of Licensing, Department of Ecology, uh, ESD, Employee Services, uh, and Commerce, the Governor's Office, Department of Agriculture, folks from all over to um, some uh, local associations representing local municipalities or county governments who are also grappling with these issues. But just wanted to kind of get together and um, present what we're seeing and perhaps have a discussion after we go through the presentations. With that, I appreciate everybody coming out today, and this is more than I thought would be here. So this is good. And I think with that, I'll turn it over to Susan um, with the Department of Health. She can introduce herself, and then as each presenter comes up, maybe introduce yourself. Then, as we're in discussion, if you can come on camera as you have a question or a discussion topic. When we get to that point, if you could just briefly introduce yourself, that would be great. But I appreciate everybody coming today. And go ahead, Susan.
Okay, great. Thank you, Todd. And I want to thank everyone for joining. Again, we have quite a few people in the room that aren't part of our routine conversations. So we want to give a little bit of a update about the concept of unapproved food vendors. Again, this is designed for those of us in the room that aren't working with unapproved food vendors on a regular basis. So again, my name is Susan Shelton. I'm with the Washington State Department of Health Food Safety Program. I am the technical lead for the program and often work quite a bit on this issue specifically. So again, I want to thank everyone, and thank you, Todd, for giving me a little bit of time on today's agenda. I'm, again, just an introduction to the concept. The meat of the issue will be covered with our local health jurisdictions in a moment. Again, I want to welcome you all and wish you a good afternoon. Many of you have probably seen reports about unapproved food vendors in your communities. A few of you maybe have even purchased food from one of them and never realized that there might have been a concern. Maybe you've also encountered these situations in your professional role, and maybe you're asking yourself why these situations seem so difficult to address. So today we'll spend a couple of minutes looking at why unapproved food vending creates challenges for communities, and then why successful responses are going to depend on partnerships from us all. So understanding some food vending. Well, most people think about food businesses, they think about restaurants, but food vending takes many forms. Across Washington, food is sold through restaurants, institutions such as schools, mobile food units that can travel from community to community, caterers that might pop up short term for an event such as a wedding, temporary events that are tied to community events such as fairs and festivals, farmers markets, and then also home-based businesses operate in our state. With a wide variety of opportunities for individuals and businesses to serve food in Washington, our health departments work to find pathways available for people to operate legally, safely, and successfully. And they base their reviews on their business style, unique risks for each operator, the operator's menu, their capacity. So while each business can vary, all approved food vendors share something in common. Their food preparation methods, equipment, facilities, and procedures are reviewed to help ensure they understand the risks and how to control them before the food is offered to the public. So again, all of our local health jurisdictions work with the operators in their communities to help them serve their food successfully, but then also safely. And the goal isn't to create barriers, but instead it's to help ensure vendors protect the health of their customers and our communities. So what do we mean then by unapproved food vending? So when we're talking about unapproved food vending, we're generally talking about food operators that intentionally avoid these types of reviews. Unapproved food doesn't automatically mean it's unsafe or safe. The challenge is that we don't know. We don't know where the food comes from, how or where it was prepared, and whether employees have access to hand washing, refrigeration, safe water, or if they've even been trained to handle food safely. For us, the concern isn't the absence of a permit, it's the absence of the review process that helps identify risks and the needed controls. Without that review, customers and communities are left with a lot of unanswered questions and potentially at increased risk. So before we continue, I want to show a short video of an unapproved food vendor from one of our local health jurisdictions. Many people assume these operators are isolated, small operations, but what we're seeing across the state are repeated examples where food is prepared centrally and distributed to multiple locations across multiple counties and states. It's not just in Washington. The food looks fine at the point of sale, but this video is going to show you how it's sometimes produced behind the scenes. Again, the video moves quickly, but I think you'll see the scale of the operation with all the transportation in the vans, transportation vans in the background. It also helps illustrate why this issue can be difficult for any one agency to address. There it is.
Of this whole thing.
So that gives an example of what we're seeing across the state. Again, we've found these white vehicles in multiple jurisdictions across from Spokane to Renton to Tacoma. We've seen it in counties in between. So again, we know it's a widespread statewide issue. So let's look at what we would consider anatomy of an unapproved food vendor cart. And this slide helps illustrate one of the challenges that we have with food safety that commonly applies to other parts of our lives. Food safety risks are generally invisible to the naked eye. So at first glance, most people will look at this cart and think it appears fine. The food looks good, the customers might be buying it, and nothing looks wrong. But just like a bridge can look safe until it falls, electrical systems look fine until they spark a fire, an animal looks friendly until it bites. Food safety programs look for the invisible. They focus on many of the bulleted items listed here. We're evaluating systems such as approved food supplies, practices such as food worker health, their hygiene, rather than just the appearance of the cart alone. So to make food safety a little bit more visible, licensed food establishments are required to have a copy of their most recent inspection for customer review. So if you're ever dining out and you want to see the business's most recent inspection, you can ask to see it. Many of them are also available online. But the business should also have a copy of their permit posted.
Of this whole.
So let's look at how who actually looks at the food safety in the state. Retail food safety in Washington is a shared system. State health provides guidance, training, technical support, and coordination. Other state agencies also have food safety roles, but the day-to-day work of retail food safety in our state is primarily carried out by local health jurisdictions. We have 35 local health jurisdictions in Washington that review plans, issue permits, conduct inspections, investigate complaints, respond to outbreaks, and then work directly with food operators in their communities. your local health food safety program is always your best contact. But they don't stand alone. They use our statewide food code, WAC 246-215. The food code is a public health tool. Its purpose is to help prevent foodborne illness by establishing requirements for things like food source, hand washing, temperature control, equipment, and safe food handling practices. But it is not designed or intended to address every concern a community may have related to food. It is not a criminal code. It is not a zoning ordinance, a fire code, or a traffic regulation. When communities encounter unapproved food vending, they sometimes expect public health to solve the entire problem. However, most concerns actually fall outside of the food code and require other partners or laws. Knowing which issue you're trying to solve helps identify the right tool and the right partner to address it. And that's where the conversation shifts from food safety to community coordination. Foodborne illness or injury is one potential outcome of a food vendor, but it's not the only concern. Depending on the operation, communities may also encounter a wide range of other unevaluated risks, such as fire hazards, wastewater issues, litter, public space conflicts, traffic concerns, unfair business practices, public safety, and others. It always goes beyond public health and includes more partners that have important roles with the food vendors. So how do we make a change for our communities? The most effective approaches are going to be collaborative and build relationships before a problem occurs. Partnership doesn't always mean enforcement. Sometimes it means sharing information. Sometimes it's education. Sometimes it's coordinating permits, inspections, or community outreach. The goal is not only to address a single vendor, the goal is to have support safe and reliable food operations while protecting the broader interests of your entire community. So with that, I'd like to thank you for your time. I'm very looking forward to today's conversation. Just a reminder, unapproved food vending is not simply a food safety issue, it's a community issue. It touches public health, public safety, infrastructure, economic vitality, and the quality of life we want for our communities. So today's presentation isn't intended or designed to provide all the answers. Instead, we hope it encourages new conversations, new partnerships, and perhaps a new perspective on a challenge that many of us are currently facing. Because again, the effective solutions will not come from one agency. They're going to come from all of us willing to work together. So we look forward to the partnership. Thank you very much.
Thanks, Susan. Yeah, and with that, we can go to the local health jurisdictions and the City of Everett, starting with Seattle and King County Public Health, EOB. Go ahead and take it away.
Good afternoon, everyone. Can you hear me, Tad?
Yep, I'm clear.
Thank you. Good afternoon, everyone. Thank you for inviting us. Thank you, Susan, for quickly summarizing the highlights of unpermitted food vending. My name is Eob Mazengia. I'm Assistant Division Director, Food Safety Program with Public Health, Seattle and King County. I'm here with my colleague, Dylan Orr, Division Director. And then I have a few of my colleagues joining us as well. We have only 10 minutes, but we'll have a few slides just to be respectful of everyone's time and maximize the amount of time for Q&A. I'll quickly go over some of these topics. I'll share with you the dashboard that we've created, the trends that we've seen locally, and then the result that we've gotten from the survey that we released to cities in King County, the new strategy that we plan to implement, which we call Progressive Compliance Plan, and then what closure procedure we follow, and go over the data collection form that we are implementing. This is what the dashboard looks like. I think there's a link on the, if I'm not mistaken, in the invitation that you could access. Unpermitted food vending, like Susan said, is not new. I think all of us have dealt with unpermitted food vending in our respective local health departments. But previous to 2023, 2022, perhaps there may have been less than a handful of unpermitted food vending operating in King County that we end up closing. For the most part, they were mom-pop operation, owner-operated, very compliant in many ways speaking, responsive. And they had, for the most part, barriers that prevented them from getting the permit, either financially or challenged with navigating through the permitting process, or just not quite understanding the requirements, but they were responsive provided that the resources have been made available to them. Since 2023, I think 2023, we ended up getting about 27 or so closures, and in 2024 jumped by four-fold to 109. In 2025, doubled that to 103 closure, and this year so far we've closed 62 of these operations. Total closure over the last 3 years have been 370 plus. Of course, this number is really a tip of the iceberg. As you know, as soon as we close them, the moment the inspector left, oftentimes they resume their operation. But the reason we put together this dashboard was because we wanted the public to be aware of unpermitted vendors that are located in their neighborhoods. But we also wanted cities in King County to know where unpermitted vendors operate, so that other agencies that are responsible for ensuring public safety and permitting and licensing related issues are also aware and able to track where these vendors are located. Majority, about 50% of them, as you could see, are within City of Seattle, the rest outside City of Seattle. Most of them are pop-up tents, but then there are also carts. The three types that operate in King County are the Al Pastor taco style canopies, cut fruit carts, and hot dog carts that are on somewhat utility cart with no hand washing or anything of that sort. This dashboard is posted on online and it's accessible to the public. In terms of the trend, like I said, in 2023 we had 27 closures, received 41 complaints, and 2024 it went up, and in 2025 it was 203. There is a steady increase that we've seen just in the last 3 years, mainly driven by centrally organized network of vendors. These are not mom-pop operations, but rather a network of vendors that, like Susan shared in her video, work out of makeshift commissary kitchens. These are kitchens that have been residential units that have been converted into commercial kitchen without permit, without any kind of oversight, that are used to prepare large amount of food. And then work across, of course, the county as well as state lines. And when we have conversation with partners outside Washington State, they report just about the same thing. They do refuse to engage public health. We not only are we approaching them with food safety messaging, but also opportunity to provide additional resources, but they have actually not been much interested in receiving the support that we made available. But they refuse to engage with public health and then reopen as soon as we walk away. Once again, these numbers barely scratch the reality. Oftentimes it does feel like we close and then at the same time they appear or they operate late in the evenings and on weekends when the oversight is not there. So sometime in March, we sent out a survey of 10 questions to the CDs in King County, and 18 of them responded. And this is what they said. We asked them what would be most helpful for your city to gain from participating in intercity meetings. These are the top 7 or so that they shared with us. They wanted to have shared best practices. They wanted to coordinate enforcement approaches, coordinate legal or policy guidance, outreach and education strategies, data sharing or trend analysis, and vendor support and pathway to permit strategies. So I'm very happy to report that we are able to provide as much of this support as we could as a food safety program in King County, and requires a lot of partnership with other cities and agencies, but these are, I think, within reach to be able to provide. we've all, over the last 3 years, our approach has been heavily focused on education and creating off-ramps. Off-ramps include creating commissary kitchen voucher programs, working with community-based organizations to help permitted or unpermitted vendors navigate through the permitting process, creating holding informational sessions that have been attended well, creating sanitarian on duty to provide technical support. The goal had all along been and continues to be to create off-ramps so that those that are interested to be permitted and compliant to be able to work under permit. Unfortunately, we're not able to report a significant impact. It hasn't been as successful because most of those that we currently encounter, maybe 75–80% of those that we currently encounter, are actually centrally organized. They're operated by workers, not necessarily owners, and they have showed very little willingness to come into compliance or engaging our program. So it has not been as successful as we thought. So we are making a bit of enhancement and making some changes to our approach. We'll still focus and lead with education, provide as much due process as possible. We will include what we call a progressive compliance plan, and I'll go over it next slide, what that entails. And then we do plan to collaborate extensively with other agencies to amplify the impact that we have in making changes, and then try to address the issue as upstream as possible, which can be challenging, but I think in collaboration with other agencies, that is a possibility. So what does our progressive compliance plan look like? It has 3 tiers. First encounter, we again lead with education. We provide educational materials. The educational material includes how to get permitted, access to commercial kitchen. The access to commercial kitchen, by the way, allows them to work out of one of the 12 commercial kitchens that we've contracted with up to 6 months for 15 hours each week. It is estimated anywhere between $4,500 to $5,000 amount voucher. We ask them to cease and desist, and then we ask them to voluntarily discard food. And we put this sticker, the sticker that is on the right, orange sticker, that basically gives them a warning that it is a misdemeanor to operate without a permit. And we affix this one on the card, but we have them close and we wait until they leave. The second encounter, again, we start with education. Just to complete what I started, education includes, again, permitting information, commissary kitchen voucher program related information, wage theft and labor trafficking type of information, other technical support that they need. And we ask them to cease and desist, and we again put the sticker, and we ask them to voluntarily discard food. If they don't, then we will confiscate and discard the food ourselves. And then the third time we encounter them, we will go through the same process, provide education, ask them to cease and desist, place a sticker, and if they don't voluntarily discard food, we will confiscate and discard food. And in addition, on a separate track, in collaboration with other partners, such as like King County sheriffs, we will issue misdemeanor to owners of the business, not operators, but owners of the business. Here's what our just high-level closure procedure looks like. We determine and verify if vendor is operating without a permit, ask them name, address, collect as much information as possible. We document extensive information. I will share with you what the form looks like. It includes taking photo for unsafe food, vehicles, payment details, social media accounts. This helps us track to the owner of the business. We provide education, and which includes, like I said, opportunities to get permitted, including community-based organizations that we work with and how they could contact them. Offer them an opportunity to come meet with us with access to language and commissary kitchen voucher. And then we document and follow through with supervisors and seniors. This is what the form looks like. It's a very extensive form. It includes inspector's name, source of complaint, business detail, name and description, person who was operating, business owner name, business owner email, as much information as we can collect. It is possible that they may give us the wrong information or refuse to do so, but then we make sure that we include all of that information. We put in the vendor type, what type of food was being sold, and then how we did the closure, and then what day it was closed, the reason for closure, and then risk factors identified. I think it's one thing to oftentimes talk about permit, whether or not they are permitted or not, but it's also another thing to talk about. What are some of the risk factors that we've seen, including lack of temperature control, lack of hand wash stations and produce, bare hand contact, and things of that sort. So we document all of that. That way we could also communicate with the public what those risks are being practiced by unpermitted vendors. The form is extensive. It does take time, but nevertheless, it is comprehensive. And then we document what are some of the barriers that they've said to permitting, because there are, again, a small percentage of those that are owner-operated that would like to be compliant, but don't have the resources. So we document what is it that they identified as barrier, so that we could collaborate in potentially finding ways to help them overcome the barrier. Supportive actions taken. What is it that we've done to provide supportive actions? Did we offer them commissary kitchen voucher? Did we connect them to the plan reviewers? What is it that we've done? And then the enforcement details, like that includes license plates, a vehicle description, description of equipment, payment information. All of that is critically important to help us track to the owner, and then also track how many times we've encountered these operators. And then, of course, our one priority is staff safety. There has been threats made toward our inspectors, so we want to make sure that we protect our staff. And we document, was there any threat made toward them, and describe that. And then which agencies we collaborated with, what code enforcement, what city will be documented. And then, of course, the compliance procedure will also be included. Was this the first time that happened? Second time that happened? Did we discard food? What was it that we discarded? And how, in what way the product was discarded? Then this form is reviewed by supervisors and seniors and myself, and then appropriate adjustments are made moving forward as well. Thank you.
Thanks, Eob.
Thank you.
Appreciate the information. And so with that, I'll go to Snohomish and the city of Everett with Tony and Dan, if you're available.
Hey, good afternoon. I'm Tony Clunas, the food program manager here at the Snohomish County. I'm going to share what, we had a lot of the same issues that Eob had in King County. This time I want to focus on kind of what I think is the success story coming out of Snohomish County in our partnership with the city of Everett. Similar issue, local health just doesn't have some enforcement tools when these operations do not have permits. And then the issue kind of comes up, what's the next steps when education isn't working? Every time we do our closures, we're providing information, how to get permits. We're not seeing any success. None of our vendors are coming forward to try and get permits, the routine ones we're seeing. As we've all seen, it's been, seemingly exponential growth of the past 3 years in these unpermitted food events, food stands. And they do seem to be all tied together. I think this is kind of a similar operation throughout all of our counties. The local jurisdictions of Snohomish County are reaching out to us, kind of wanting to know, hey, why are you guys not doing your jobs? And when we start explaining, hey, we don't have the resources for that next level of enforcement, it starts from the conversations. So City of Everett reached out to us last year, had this conversation. It went first in doing some site visits. We teamed up with the City of Everett Police Department doing some nighttime closures. Our inspectors went out, and it started a great conversation, and the City of Everett moved forward with their own ordinance. And Dan Templeman with the City of Everett will share the process and kind of the success story they've had with it. See if Dan's here. Oh, Dan did tell me he was having some technical issues, so we'll see.
Tony, can you guys hear me?
We can hear you, Dan.
Okay, great. Well, thank you very much for having me today. And as Tony mentioned, I am having some technical issues with Teams today, so I've asked Tony to holler at me here on Teams if my audio starts to fade in and out, but hopefully that won't happen. Real quick, my name's Dan Templeman. I am a senior executive director with the City of Everett. I work in the mayor's office, and I've been in my current position. I oversee public safety in our infrastructure departments. And prior to taking on the position I'm in now, I spent 31 years at the Everett Police Department and retired after almost 10 years as the police chief. And so while I have not had direct experience with this issue, the mobile food vendors, when I was in the police department, I've certainly had experience with drafting ordinances and leveraging law enforcement to address community issues and public safety and health issues. So real quick, I'm just going to take you here on about a 10-minute journey over about 10 months of time. And so in early 2025 is when we here in the City of Everett started to receive an increase or a notable increase in these complaints coming into the mayor's office. And one of my roles in the mayor's office at the time was fielding and responding to a lot of constituent concerns. And this issue really focused around three main areas that I noted. The community members and organizations and some of our brick and mortar restaurants were complaining about business fairness issues related to these unpermitted vendors. There were obviously public health concerns that were being raised. And then with some of our pedestrians and wheelchair users, they were having issues navigating some of the sidewalks. And so that was presenting a safety issue. And so the first thing I really tried to do is before we went down this road of creating a new ordinance to specifically address this, was look at what our current ordinances were that we had on the books. And did we here in the City of Everett have a current law on the books that we could leverage to use to address this behavior? And we had a couple different things. I pulled a work group together to look at this. We do have a municipal code that requires all businesses obtain a business license if they're going to be operating in the City of Everett. But this really focuses on the business owner and not the operator. And so the question really came up, well, then who do we enforce against if we're unable to identify who the business owner is? And so that was a challenge. We then looked at, who could enforce if we even were to leverage this. And our clerk's office didn't have the resources. Our code enforcement didn't really have the resources. And their interpretation is that code enforcement really only enforces on property owners, which again presented a challenge. The blocking of the sidewalks, that was one that we discussed quite a bit with law enforcement. And while it could be successful in some situations, it was limited because we knew that these mobile vendors would just pick up and move to adjacent private property or situate in such a way that they were still on the public sidewalk, but just not entirely blocking it. We looked at the fire marshal's office. They did have some limited jurisdiction, they believe, but again, it was not clear and again, very under-resourced department. So that we were just really determined there was no real good tool for us to address this specific issue. So we then also, while this was all going on, we also reached out to Tony and his team at the Snohomish Health Department and realized they'd been working on this issue for quite a while. We asked for their support, and that's when we first really started to dig in and discover some of the challenges that our local health department was facing when it came to enforcement and really their mechanisms and tools to be able to permanently or long-term address some of these issues. We did coordinate with the health department and conducted some joint operations, which was really useful to our team, our law enforcement team that was out and informing us, because it really made clear how obvious the lack of the ability for the health department was to operate or to identify some of these operators. to figure out who the owners of these stands were. We realized and recognized just how highly mobile these stands were, that they would sometimes close down and within hours reopen just in another location. And so it was apparent that the health department did not have a real viable solution to address this issue long term. We reached out to other jurisdictions. I know Eob and his team with the King County Department of Health. I had some conversations with that team. Other jurisdictions, other agencies within the state of Washington. And while we were doing all this research, these complaints continued to pile in, and it was just the volume continued to just increase. And then we started to get some media interest. I know that in the link to this meeting, there was some links to some of the media stories about these, the proliferation of these unpermitted food vendors and how challenging it was from an enforcement perspective to deal with it. And that's when our Mayor Franklin here directed me to really explore creating our own ordinance, because if we didn't have a perfect tool in place currently in Everett to deal with this, and our other local partners didn't have effective tools, then she said, then let's create one ourselves. And so I knew from the conversations that we'd had with our local health department and from the officers who'd been out making contacts at these unpermitted stands, that we needed to have as a component of this ordinance an element that would require an operator to identify themselves, and that would hold operators also responsible. And I know that even with our own city council, when this was being deliberated through the public process, there were questions about, the operators and should they be responsible, and were they victims in this? And I think in some aspects they may be when it comes to labor laws and other areas like that, but in many cases, at least in our experience, was that the operators had knowledge, because we had contacted them multiple times and told them that this was not legal to do, and given them numerous warnings. So we wanted to make sure that element was part of it. So we began drafting an ordinance, and one of the elements that was also really important to me, just having come from the police department myself, and knowing that our code enforcement teams, our fire marshal teams, our health departments were all under-resourced, was not creating an ordinance that was so cumbersome and so complicated to enforce that it would never be enforced, but trying to create and craft an ordinance that would allow us to effectively manage and address this situation with a minimal amount of resources that would still pass constitutional muster. So we worked with our legal department quite a bit in our teams, and our ordinance contains several primary buckets, and I'm just going to address high level. First of all, it doesn't apply to food trucks. In Everett, our mobile food trucks are regulated by a separate ordinance. But this really applies to mobile food vendors that prepare or package food directly to the public out of tents, booths, carts, kiosks, or other non-permanent structures. Even though it's required in a separate ordinance, we wanted to reaffirm this ordinance that any operator of a mobile food stand fitting the definition is required to have a City of Everett business license. We restricted the hours of operation in location, so you can't operate in Everett one of these mobile food stands after 10 o'clock at night or before 7 in the morning, and you can't set up in certain areas like bus stops and driveways and public streets or sidewalks. One of the elements that we wanted to address that we saw the health department, when we were doing some of the joint operations, that they were challenged by, was a requirement for operators to identify themselves. And so we explicitly wrote that into our ordinance. So it does require that an operator identify themselves. And if they don't, it's a violation of this ordinance, which is a misdemeanor offense. And then as far as enforcement, we wanted to build in a mechanism that allowed our law enforcement and our fire marshal explicit enforcement authority. So there was no confusion, code enforcement saying we can't do it, it's got to be police, or police saying we can't enforce it, it's got to be, the clerk's office enforcing. So it explicitly outlines who has enforcement authority. The ordinance makes it a misdemeanor for an operator to be operating a mobile food vendor in violation of the ordinance, and it elevates it to a gross misdemeanor for the owner or employer, which is a critical component of the ordinance in terms of accountability. And we know that a lot of times trying to track back to the employer is challenging, but we knew also that if there was no accountability level at the operator level, that even trying to get information on the owner would be difficult. And then the last bucket that is included, even though with police cases that you always have the authority to impound evidence of a crime, we did write into the ordinance that impounding of equipment is appropriate when it's deemed necessary by the investigating officer, and that it can be released. If we're going to release it, it'll be released to the owner or the employer when it's no longer needed for prosecution of the case. So those were all elements that were really important to us as a work group as we worked through this. We collaborated with the health department and shared the draft ordinance with them to solicit their feedback. Again, at the council, when we went to council, there was question about punishing the operators, and the questions about if they're victims, are they victims of human trafficking? Those questions were all raised. Our officers are all trained to identify, and our prosecutors have quite a bit of discretion when it comes to who they will prosecute. And if we do run into situations where we do have human trafficking involved, we have other resources that we can divert those cases into rather than pursuing criminal charges. So far, though, our officers that have been out doing these contacts have not identified any instance here, at least in Everett, of human trafficking. Labor law violations, yes, but not human trafficking. So our council passed this ordinance on February 11th of this year, 2026. The Everett Police Department, with our communications team, created an outreach and education flyer in multiple languages. And then we used a team of officers, including bilingual officers, to go out and educate these operators for about a 2-week period before the ordinance took effect on the 26th of February. And our approach has been to educate and warn and only enforce if needed, and impound is a last resort, and this has proven effective. We had, throughout the whole year, last year in 25, we had up to 7 mobile food vendors that were operating in the city of Everett on a regular basis, almost nightly. We reduced that number to 2 by the time the ordinance took effect at the end of February. And after February, when the ordinance took effect, that number's now been 0. And I've not received one complaint from the public into the mayor's office since this ordinance went into effect. We know that displacement has occurred. We know that a lot of these vendors have moved just outside the city of Everett, but our team continues to monitor it today and stay on top of it. And if one does set up, we address it pretty quickly with that outreach information. And again, it's proven effective. We have not had to issue any citations or make any arrests yet. And we appear to, at least at this point, I knock on wood, have full compliance. So with that, I'll pause and pass it over to back to Todd.
Hey, thanks, Dan and Tony. Yeah, appreciate it. Or did you have more, Tony?
No, I was just going to echo Dan's. We have no complaints inside the city of Everett limits, but yeah, they're setting up right outside the city of Everett limits in unincorporated Snohomish County. So if we work on that, we get those ordinances passed. We're thinking that may be a path forward for us. But we also haven't seen any of the complaints coming in. Where Everett was one of our high volume complaints in 2025, and that has completely gone away off our radar from the ordinance.
Yeah, and it's there's a theme, folks, going to the path of least resistance, and so it's why everybody, I think, has to come together eventually, and it's a community effort here. Appreciate it. So from here I'm hoping to keep some time for discussion and question and answer at the end. So we'll go with Tacoma Pierce and Jessica, or who is presenting for Tacoma Pierce about denaturing food and working on the right-of-way issues.
Hi, I am Kara Gallagher. I am an environmental health specialist supervisor with Tacoma Pierce County Health Department, And Jessica asked me to talk about this because I have direct experience with it. I'll start with denaturing. We started denaturing foods with this process in early 2025. Unapproved street vendors in Pierce County were setting up on public property without any available services, or on public property without permission. And we started denaturing for a number of reasons. Rarely the location on site for the vendor had a place to dispose of food without causing further public nuisance. In the case of the fruit carts, we've talked a lot about the pastor vendors. They cannot leave the right of way. They're getting dropped off at a location until the end of the day, and there's no way to transport the cart while we're on site. So we needed some way to render the food unsafe without confiscating it, which we don't always have the best process for. Al pastor vendors are setting up in the same location each night after being repeatedly asked to leave. So we had to have some further consequence, some sort of deterrent method. And we hesitated to use bleach because of the language barrier and the history of noncompliance, and we didn't want consumers to fall ill because of our actions. Our program manager had an idea to use food safe dye to render the food unpalatable for the consumer. We mixed together food dye and vinegar, and we used that to denature might not be the right word because you could still eat it safely. But we first try to get them to combine the food into like a shared trash can, and then that will take care of most of it. And then what is left, we will denature what they refuse to throw away before we leave. In the case of the fruit vendors, it's especially effective because it definitely ruins the aesthetic of the product. Oftentimes, whenever we would close one, the minute we drive away, they would open right back up. So at least this time they would be done until they were picked up or until someone showed up to re-up their supply. It's not a perfect process, but it has been helpful and given us something that we can measurably do while on site in intervention. I also want to talk about working in the right of way. So I will talk a little bit about the progression of how this has worked out in Tacoma-Pierce County Health, for Tacoma-Pierce County Health Department. Our first LFAS store vendors were set up in the city of Tacoma. Our temporary event coordinator had existing relationships with the city tax and licensing officers, and they were able to go out with us after we noticed that this was becoming a repeated problem across the city. They were also getting complaints as well within the city of Tacoma, not just to the health department. They were able to issue citations, and they helped drive the vendors out of the city limits of Tacoma for a time, so we can relate to the city of Everett and Snohomish County and that effect. In unincorporated Pierce County, we noticed a rise in operators. And unincorporated Pierce County is a pretty big chunk of the area of Pierce County. Not like a ton of it is within city limits, and it's pretty spread out. So we reached out to code enforcement officers first because that is an existing relationship we had for dealing with unpermitted businesses that are operating out of a home. But they were incredibly supportive, but unable to assist. Like other jurisdictions have outlined, that the code enforcement process is more for like a permanent structure or a private property. And so someone who's creating a nuisance in the right of way isn't necessarily what they're working on. I know they can do stuff with like abandoned RVs and vehicles, but not people who are operating a business. We also reached out to the fire marshal because they have some enforcement capabilities in that area. They went out with us a few times in the summer of 2025. I believe they issued some citations, and they provided a lot of information to the operators about the safe use of propane tanks because they are operating right on the side of the road in high traffic areas. They were very supportive, but the vendors kept returning without a behavior change, and this wasn't an effective use of their time. We continued to receive daily complaints from the public and business owners about unpermitted street vendors. And this is especially difficult because we have one location in particular that it's set up directly across the street from a permitted taco shop. They're paying their taxes, they're paying rent. They can't compete with the prices that a vendor that repeatedly is operating without any of those overhead costs. So we continued to reach out to find some partners. And one day I got a complaint from a business owner about grease being dumped into storm drains across unincorporated Pierce County, specifically along Meridian. It's the state right-of-way that goes out to Mount Rainier. If you've ever been out that way, I hope you have. I reached out to Pierce County and their source control, and they put me in touch with an investigator from the Department of Ecology who was investigating the spills. This investigator, I don't believe he's present at this meeting, was incredibly helpful. He went out with me and we looked in the storm drains. We saw lots of taco grease. We did some investigations and we're monitoring the sites. They were unable to show that the spills were affecting the waters of the state, and worked with the Department of Transportation and Pierce County Public Works to get the spills cleaned up. But we were not able to link it to an owner, and we were not able to show that it was further affecting bodies of water in the area. Though this did hit a dead end for our partnership, it led to a series of meetings between the Department of Ecology, Department of Transportation, Washington State Patrol, and the Pierce County and Pierce County Sheriff to talk about more about possibilities for partnership in the right-of-way. And it shed a lot of light on the issue in the area and started a lot of conversations about ways that we can collaborate, and also opened up a lot of pathways of communication when not all of us knew who the right person to reach out to in those areas was. Pierce County set up some signs and barriers at the locations where the dumping occurred. The barriers did provide a temporary deterrent, but they eventually found a way to work around them, and it was not a permanent fix to the issue for those locations. Eventually, our meetings with the Department of Transportation and Washington State Patrol started to fall through because of the level of effort, the level of work it would require on the state level and with the governor's office to get them to make any more interventions, which is completely understandable. But we have continued to work with the Pierce County Sheriff's Office to try and figure out a way to collaborate with enforcement. They are violating a Pierce County code by operating in the right-of-way. They're not supposed to be set up there. And we have some joint enforcement efforts planned for this summer. We're still working out the best process on how to do it, but we're optimistic because now we have a few partners.
All right, thanks a lot, Kara. And we'll go to the other side of the state, to Benton Franklin Health District. And Aaron will give us a presentation on working with law enforcement specifically.
Thank you, Todd. I'll try to make it brief since I know you're hoping to save time for questions. Hi, everyone. My name is Erin Hockaday. I'm the Environmental Health Director for the Benton Franklin Health District. So our health district covers the Tri-Cities area and kind of surrounding county and some smaller cities. I know Todd asked us to come talk about our work we've done with law enforcement here locally. We've worked with some of our law enforcement agencies to set up a local task force. And so really, I think where our work culminates is kind of in the place where Susan and Tony and Dan and a lot of people have already highlighted, which is how having multidisciplinary partnerships are going to be really critical to solving this issue. It's not just a public health issue. So that's really where it lands. At BFHD, we've used the non-emergency line for years to call for support in the field, both for our land use staff, our food staff, typically only when there is a safety concern. So we sort of got into this issue with, same as you've heard from all the other counties, we're seeing the exact same things. And we had some instances last summer, early in the spring of 2024, 2025, where our staff had run into some safety concerns in the field, mostly from the public, some kind of pretty aggressive behavior from the public. So as a pattern, we started when we went to after hours calls for these unlicensed food vendors always calling, putting in a service call for a law enforcement officer to come meet us. And that was going well. We saw something really similar in our data to what EO reported earlier. From 2024 to 2025, we saw our complaints of unlicensed food vendors increase by 120% over the previous year. We also started seeing some really distinct differences in how they were operating and the type of operation. So when it became clear to us that this issue was bigger than us just here locally, we reached out directly to one of our police chiefs at one of our larger cities and asked if we could sit down with their staff and their attorney. So we went, myself, our food safety team, supervisor and leadership, as well as our district administrator, and we sat down with the police chief, one of the sergeants, as well as their city attorney, just to talk about kind of starting to collaborate there. Soon after, some of you may have worked with the Fair Play Coalition. They were reaching out to multiple municipalities, kind of expressing their concern on the issue. They happened to reach out to the same police chief, and that police chief then called together a meeting with us, their office, the governor's office, somebody attended, as well as they brought some local business owners and some business owners from the west side of the state. So when I look back at kind of our trajectory and the success we have had in working with law enforcement, I think that meeting was really critical because it brought together public health. We were able to share our experiences, what we're seeing. Our local business owners were able to share the experience they're having with impact to their business. The West Side businesses that came, that was a surprise to me that they were bringing businesses from the other side of the state, but it actually did a great job of highlighting to our law enforcement that this wasn't just a local issue. It was bigger than just Tri-Cities. And then the Fair Play Coalition, they had a lot of depth of information on kind of the level of coordination planning on this entity. So in the end, that meeting, I think, highlighted for that particular police department we were working with that this is not just a local mom and pop operation. This is, an organized cash only criminal operation that's really having some impact on our local businesses. So it really drove home that point that Susan was making at the beginning, that this is not just a public health issue. So from there, that spurred a lot more engagement. They invited that police chief and one of our commissioners invited me to present at our local Law and Justice Council, which is a kind of a collaborative council that includes all of our police chiefs, sheriffs, judges, PAs, kind of everybody involved in that realm. And through that presentation, they advised us to stand up this local task force. So that's what we've been doing. We've pulled together, and I think it was really critical to have that initial meeting with that police department because that particular police chief has sort of become a champion, so to speak, in the issue. I don't believe that if it were just public health coming into the issue as the de facto lead, that we would have had as much buy-in as we have. So that particular police chief has offered to coordinate, has reached out to his counterparts across all of our other cities and counties, and has helped to engage other sheriffs and police chiefs and detectives, their detectives division, a lot of people in that group. So this task force that we put together, it consists of our heads of our local police departments, our sheriffs, as well as county and city prosecuting attorneys. And then later we also added in another pretty critical element, which was all of our PIOs. So all of our PIOs for each of the law enforcement divisions, as well as public health cities and counties, just to kind of tackle that public messaging piece of the campaign. So what we're really doing is we're sort of evaluating an enforcement approach. So trying to come up with collectively an enforcement approach across the group. It was critical for us, especially as Tri-Cities is made up of multiple cities, but we sort of functionally operate as one city. And so each of the law enforcement, heads that were there made it really clear that it was important to them that we didn't just push the issue from one city to another. We didn't just want to shuffle it around. And so we wanted to make sure we're kind of tackling it in lockstep. So coming up with a common enforcement strategy, We are also have kind of a wing of the group, mostly the attorneys that are in the group are looking at municipal codes, researching laws and authorities that patrol can then utilize in the field, and looking for those opportunities to update their local codes. In fact, I know Susan had shared with me before the city of Everett, so I really appreciate that presentation they gave just now, because I know that that ordinance is something I've shared with that group, and they really appreciated seeing that. And then lastly, we've got the PIOs involved in the group as well, and they're sort of working together to talk about a common approach. Our office has come up with sort of a public awareness campaign, but then we're working through the other PIOs to share that campaign, to amplify messaging. If we receive feedback from the public, we've got kind of a common agreement on how we're going to operate together to face those kind of issues. So that kind of collective and collaborative approach has been really critical through that group. The last thing I wanted to share too was well, this approach is working to get agreement and consensus and a lot of discussions, frankly, that we've needed to have for years between public health and law enforcement. We are still seeing struggles with the vendors. Our data has not shown any drop off in the number of unlicensed vendors that we've shut down this year versus last year. However, we have seen a really big switch in this year. We're seeing a significant amount of fruit carts and far fewer of the taco pop-ups. So we are seeing kind of a change in the type of vendors, but we haven't seen a drop off in the numbers quite yet. So we're still working towards it. We still have some jurisdictions that haven't engaged or are minimally engaged in the group. So there's still certainly work to go, and room to grow there. But a lot of the engagement in this group, in this law enforcement task force that we've gained, has been gained through advocacy with our elected officials. So originally, our office sitting down with particular commissioners, with our board of health, we have gone around and done presentations to many of the city councils. We hosted a community town hall meeting. And so a lot of that engagement in that law enforcement group did not come until we went to the city council, presented at city council, and then their mayors or their council had conversations with their police chiefs or law enforcement groups. We've had some success through that advocacy recently, where just last month they presented at another city council meeting, and afterwards that city mayor approved a budget for that city to hire 2 temporary code enforcement officers for the summer just to focus on this issue. So for, I think, the public health partners on the call, I would say that's a really critical piece that if it hasn't been added to your repertoire, that I would really recommend that you tackle that piece as well to get a little bit more engagement. That's where we're at from our side of the state. I know we see a lot of it over here, and so but we have a lot of room to go, as I said. So I'll hand it over. I think I'm handing it to Sean. Todd.
Okay, go ahead, Sean. Thanks, Aaron.
Right. Okay. I will also be brief, so we have time for Q&A. I want to thank everybody for joining and listening to our experiences on this issue. My name's Sean McGee. I'm the Environmental Health Director with the Yakima Health District. I've been asked to talk about kind of the evolution of the experience overall. Our process, I would say, is very similar to a lot of what's been talked about by the other local health jurisdictions today. What started as receiving complaints about pop-up food vendors typically operating late evening into the early hours of the morning, Thursdays through Sundays primarily, specific times where regulatory agencies are not typically going to be out and about in any kind of force. This quickly evolved into myself and other members of our environmental health team, and even some of our executive leadership team going out at night and making contact with the 6 or 7 Taco Al Pastor vendors that were operating at any given time, which we found out, we would close them down, ask them to leave. We would provide education on how to get permitted. That started with, sounds good. We'll come pay you guys a visit. tomorrow and talk about how we could do this legally. They never did. So we'd go out again, we'd catch them, a second, a third, a fourth, a fifth time on some occasions. And we finally got to a point where, we started reviewing our processes and determined that, we could have the food discarded and denatured if we had to do that. And once we got to that point, we were hitting these folks where it mattered to them. It was their wallet. We were limiting their ability to bring in revenue for their specific stand, which if we do also believe it's an organized effort of some sort, and the money's being funneled somewhere else, and they get potentially a certain percentage of what they make. But either way, we're hitting their bottom line, and that is the money that they're bringing in by selling this food. Then we started being met with resistance, a lot of verbal hostility from the operators, and then one instance where one of our staff was even threatened with a knife. So we pulled back at that point. We took a week or two to reassess the situation, and that's where we got law enforcement involved as well. Started looking at municipal codes, and quickly realized, like I think several other health jurisdictions and municipalities have realized, some of these municipal codes regarding this specific issue haven't really been addressed in years or updated in years, or some of them have never even been regulated in the realm of retail food and pop-up food vending. And some of the definitions were a little too loose for prosecuting attorneys to feel comfortable moving forward with charges. We found that out through a joint effort with Yakima Police Department, where we shut down 5 vendors in a night. And there was one group that was repeat violators. I think it was the 6th time we've caught them. And they were pushing back on YPD and Yakima Health quite a bit. And they were cited with criminal charges through the City of Yakima Municipal Code. And those charges were dropped because of the definition between street vending and mobile food vending. Because they showed up with a vehicle, they felt that they were defined as a mobile food vendor. Different from our definition, but that's how the municipal code read. That municipal code is being updated, and that will be fixed. And then other municipalities. And from there, we pushed out a survey to all our municipalities, much like Seattle-King County did, kind of asking the questions of, have you looked at your code? Do you need assistance updating your code? Are you interested in partnering with us so we can help address this issue? I think we received 10 responses of the 14 municipalities, because 4 of our municipalities basically said we have it handled. And they, similar to the city of Everett, kind of passed their own local ordinance that basically said, we don't allow pop-up vending of any sort within the city limits, except for special events and festivals. So it's not a problem for us. Our law enforcement's handling it. And throughout this process, we also set up a task force with the city of Yakima, code compliance, and YPD, where we would go out together. First contact was mandatory closure, and they could leave without incident, and we may not make them destroy the food. They always would say we want to keep it for ourselves and our families at least, so it doesn't go to waste. The first, first incident, we would allow that. The second time, though, if we caught them again, it would be they'd be required to discard food. And if they didn't do that on their own, and the health district was forced to discard and denature the food, then YPD would step in and basically cite them under noncompliance to the municipal code. And also under, I forget the RCW off the top of my head, but the RCW under the health officer powers and duties to mitigate public health risks and threats. I'd have to dive deeper into that. But however, YPD was confident that that RCW basically said if they did not comply with the orders of the health district, they were in violation as well, and it could be cited under that because the municipal code says they must comply with health districts regulations as well. So where we're at now, that led to this task force kind of working together and kind of coming up with a workflow process, and we developed a workflow for law enforcement, like a law enforcement toolkit, if you will. Where we're at today, City of Yakima, we have not had to respond to an unlicensed vendor after hours since about March, I would say, as code compliance and YPD's crews are well educated on what's going on, and they will stop and visit a vendor, ask for permits, and if they don't have the necessary permits, they will ask them to shut down. They will call our on-call person, which is me, and basically go over the scenario with me, and then I can give confirmation that that vendor should be closed down. And then from there, law enforcement has their own discretion to cite them under any municipal code violations that they want. Much like King County, we don't really want to go after the operator. We want to go after the business owner or the organizer for the region that these folks are operating in. However, it's all put together, so they are pressed to give up that information for law enforcement to reach out and communicate with higher ups within these food vending organizations. 100% of the time, they're refusing to do so. So law enforcement has no choice but to cite the operator at that point. Really, what we see though, and I think where the evolution of this whole experience is coming in is, certain local health jurisdictions are finding a way and putting together pieces of a puzzle to address this from a public health standpoint. And law enforcement is, I think more so as this goes on, jumping on board with us and working in collaboration with us. But what we're seeing is the more we enforce in like the city of Yakima or the Tri-Cities area or Seattle or Tacoma, Spokane, they move outward to the outskirts of these cities, or they move to different cities. Aaron and I have had, with Aaron, who just presented with Benton Franklin, have had many conversations about, I just did an enforcement event for a solid week. So more vendors pop up in Benton Franklin counties. You'll do some and they'll pop back up in Yakima, or we'll do them at the same time. They move off to Moses Lake. So they're very mobile. They will travel far distances. They have many hubs across the state, and they will go to the cities that don't necessarily have a plan put together to address the issue when they do show up. They kind of are evolving with us to avoid us, where this is certainly a statewide issue. And in addition to just the public health aspect, they are taking money out of folks' pocket who are putting in the time and spending the money to go through the process properly. They're paying for their city business license. They're paying their taxes. They're paying their permit fees to local health jurisdictions. And they're doing it the right way. And that business is being taken from them, from people who, largely in my experience, don't want to comply. They want to be a cash-only operation, or they're directed to be a cash-only operation, and that's how they're going to operate. And if they get caught and they get shut down, they're going to go somewhere else the next night, where they feel, they have a lesser chance of being caught. And that's just how it's been going. I think that's how it's going to continue to go. And the one unique thing about Yakima County, and I know there's several other counties that have tribal lands within their borders, is a lot of the vendors we have made contact with and have been made to stop operating on public land. They've moved down to the lower Yakima Valley within city limits of, let's say, Toppenish, Washington, and they will go right across Highway 97 onto tribal land, and there will be a series of taco vendors popping up there, and none of us can really address that issue because they're on tribal land, but anybody can go over there and buy their food, which we know is not meeting food safety requirements. And haven't had the best of luck as of yet communicating with tribal public health agencies to help address that. We know that they do get some sort of permit to operate on tribal land, but they're still not meeting if they were operating on public land, they wouldn't be meeting any of the standards in our food code or our local requirements. So just because they're operating somewhere where we don't have jurisdiction, the risk is still there to our public. So another complication and wrinkle that's been thrown into this that we have to navigate and collaborate with our tribal partners for the long term. But I guess the main point I'm trying to get for evolution is has been, and we're a statewide issue. And the more we learn about this and experience this issue, the more it just shows that it's a statewide issue, and the need for statewide action to help address this, just even beyond public health, is absolutely necessary, because they can be in any small or major municipality at any given time, depending on who's doing what. They react to what the regulators are doing, and they just keep moving around and finding the soft spots around the state to pop up and operate successfully. With there, I'll pass it on back to Todd, but I think Spokane's up next.
Yeah, thanks, Sean. And on to Jessica with Spokane Regional Health.
Hi, can you hear me okay?
Yep.
Okay, so yes, I'm Jessica Martin with Spokane Regional Health District. I manage the food safety program. I also have Allison Wiley in the crowd. She's our technical advisor of the food safety program. She will tell a great success story that we actually had associated with Yakima. So that'll be fun for Sean. I'm going to try to share my PowerPoint, but if not, I can just read off of it as well. So let me know if it comes on or not. Something's happening. Okay, so just, yeah, you can probably see all my slides, unfortunately, but for time's sake, I'm just gonna follow what it is. So unpermitted food vendors in Spokane, we have seen an increase in complaints and closures and all the things, but honestly, the most complaints we receive are from businesses and not the public. We don't have a lot of public support in Spokane. The businesses are pretty upset. We've had some, letters sent to us. We've had complaints. We've had them involved on our task force. And I get where they're coming from, and I want to support them and trying to get this resolved. But yeah, so most of our complaints are coming from our business owners. Currently, we are partnering with you all, with our local cities and police and fire. Our food advisory committee here in Spokane is pretty passionate about this topic. I've met with the local board of health a couple of times. I have support from them, it seems. We're using social media, blogs. Allison and I both have been in the news, in print and on TV, trying to gain support. But again, we're not seeing a lot of public support in Spokane. With the local board of health's, what they wanted us to do was to build a task force that included local cities, police, fire. We've had Sheriff's Department all involved, and we did build that task force. We met several times, and like Susan said in the beginning, just being able to share these stories and meet people and interact about the same issue, to me, is success in itself. And so we'll continue to do that. Allison and I have met even with some of our prosecuting attorneys. And we started doing Department of Licensing license plate lookups. So when the inspectors go out to issue closure notices, they take pictures of the vehicles, and it's usually the white vans that the food is being placed back into when they break down their booth. And they'll take pictures of that and the license plate, and then we can look up the license plate. And I have sent the copy of the closure notice that was issued, the fine, and a cease and desist letter that is fairly threatening, I think. So it's kind of where we're at now. Some success stories. The Department of License Plate Lookup did result in our fruit vendors to discontinue. A lot of that, again, was with help from a local business person who was upset about the fruit vendors. For whatever reason, she herself took it upon herself to send us in pictures from weekends and things like that. And with her help and the license plates, the owner of the fruit vendors in Spokane came in and met with me. He did pay all of his fines, and he did stop operating. He had like 8 carts going at once all the time. It was constant. We started collaborating with even further into our cities and agencies. One in particular, Downtown Spokane Partnership. They have actually reached out to me to ask me for help because they're having issues downtown at night and on weekends with sidewalk right-of-ways and different things like that, nuisance, garbage, and there's vulnerable populations downtown that we worry about with food safety concerns, of course. And so I issued my support. I said, I'll do whatever you need me to do in hopes that they will reciprocate. So support is increasing. It's slow. And yeah. So this is the success story with Yakima that I'd like Allison to tell her story, because she was the person that, worked this out. So go ahead, Allison.
Yeah, and this was just a great story for like success with collaboration amongst like LHJs and other jurisdictions. So we had one vendor, unfortunately, this didn't quite tackle our large scale issue, but we just had a single vendor. She was coming to Spokane, usually on Sundays, camping out in front of other Mexican restaurants and other Mexican grocery stores, and basically setting up tables with, you can see butchered chickens, creams, cheeses, produce, baked goods. A lot of the businesses weren't happy with this because she was kind of piggybacking, making it look like she was part of a permitted association. So what we did was I called her, I provided education. She said she'd stop. She did not stop. She told me she was permitted in Yakima. I called Kate over in Yakima. I was like, hey, she says she's permitted. What can you tell me? She was not. She hadn't been permitted in Yakima for several years, but they were able to help provide me some contact information from her file. So we used that to mail an official cease and desist letter and just reiterate the operation was not legal. And in that process, I looped in just like a USDA contact from the beautiful DOH SharePoint page. And I said, hey, I see that there's butchered birds here. Her Facebook suggests that she's raising and butchering these birds at home and then transporting the meat unrefrigerated. This got USDA involved. We had a clear line that this was not USDA processed meat. And someone actually called me and was like, I'm flying up from California because you told us about this meat, and so I need to know where to get a hotel. And I'm like, well, you should probably work with Yakima. So I sent her over to Kate, and then I got a response back like about a week or two later. She flew up, the USDA inspector flew up from California. She met with Yakima, and my understanding is she went to the operator's home, and the USDA inspector issued fines and a cease and desist, confirmed that she received our cease and desist. And to my knowledge, she's not come back to Spokane. I hope she's not come back to anyone else's counties, because she was transporting this all around the state from what we could see. But that was just a really like satisfying, immediate reward to collaboration.
Thank you, Allison. So all that I really have left is just some concerns, still, of course. The concerns that we all share, plus in Spokane, we are having some staffing and capacity issues with, you know, sending because I have a safety concern, that kind of freaked me out what Sean said, but I have a safety concern. And so I send out 3 inspectors at one time. One that can, look at the booth and talk and take the pictures, one that's kind of manning the crowd because they start to get upset, and then one that's using an app that we have at the health district for translating and talking with the person at the booth or the people at the booth and issuing the closure notice and fine. So sending out 3 inspectors and then they just move down the street is, it's frustrating and it is hard to do. And I have severe safety concerns for them doing that at night. We do need more support, and we need more support from our cities, from our police, from our fire. We get a lot of support in the meetings, but then that's kind of where it stays. It doesn't go past the meetings, unfortunately. Also, with all those cease and desist letters that I'm sending out with the fines and everything, they're not being paid. There's no response. Again, I support our local businesses, and that is an unfair business competition. And I do worry about the public perception in Spokane. We've heard a lot about that here and there throughout these presentations, where the public is usually the ones that are more angry. They think that we're hurting someone's, small business, mom and pop business kind of a thing, when they don't understand, really how large this is, and that we consider it more of an organization than a small mom and pop that is just trying to make some money. And so we're having a hard time with that. Every time we do social media or blogs or actual media, we get, just hammered with terrible complaints and comments and things like that. So it's kind of interesting. We've actually been sharing, King County had a news video that it was really fantastic because it was from the perception of the business owners. And we've been sharing that video. It was on Facebook from one of their news outlets. And it was really neat because it was from the business perception instead of from the, the evil health department. And it went around and it showed how unsafe the food was and how, it's a business minded thing to do to, get your permits, get your licensing, work with other agencies, do it right, do it safely, have support and from those other agencies. So I've been sharing that video a lot. Our food advisory committee really enjoyed it. So of course, areas for improvement. We still need support and we need to still do more outreach. So that's the end of my presentation. Thank you. And I don't know how to unshare, unfortunately. Hold on.
Thanks a lot, Jessica and Allison. And we are at time. I appreciate everybody showing up to the state agencies and the associations. If you have interest in connecting further, you can reach out to me. I can help get you in contact with these local health jurisdictions. If you want more details on what they're seeing out there, I encourage you to connect. And I hope you all have a good rest of your day.
Thank you.
Thank you, everyone.